Hi everyone, thank you for listening to my presentation today. My name is Samantha Bush and I'm a second-year medical student at the University of Wisconsin School of Medicine and Public Health. My presentation is titled Inpatient Pediatric Care and Physician Workforce in Wisconsin, the State of the State. To put our research into context, first we see here that inpatient pediatric beds have decreased by 11.8% nationally from 2008 to 2018, with a steeper decline in rural areas. Of note, Wisconsin had the second greatest decline in number of beds as well. Additionally, many hospitals throughout the U.S. had a decline in their capability to provide acute inpatient pediatric care, which also had the greatest declines in rural hospitals. It was also seen in the study that pediatric ED transfers, or emergency department transfers, were increasing at all hospitals, likely going to children's centers or hospitals with higher acuity for admission. However, it has been seen that 50 to 70% of pediatric patients continue to be admitted to general hospitals rather than children's hospitals, so there is still a great need for an inpatient pediatric care workforce in these general hospitals. Zooming in now on Wisconsin, Wisconsin has a significant portion of its land designated as rural. Approximately 24% of the population is also designated as rural. There are 58 critical access hospitals in Wisconsin, which are rural acute facilities designed to improve essential access to health care. However, a recent study has shown that critical access hospitals see few children and are challenged to remain proficient in caring for their inpatient pediatric patients. Now, family physicians have historically provided inpatient pediatric care in hospitals across the U.S. However, the newest proposed family medicine residency training requirements exclude the requirement for inpatient pediatrics specifically, and rather states that the program can provide a broad spectrum training that meets the mission of their program. Overall, given the projected and current physician shortage in rural areas, up-to-date information on the status of inpatient pediatrics in Wisconsin is necessary. And this is to help guide residency programs to train physicians who can meet the needs of the state, but also allows healthcare and public health officials to determine where the greatest needs lie across the state. Next, we will move on to our methods section of our research. To gather up-to-date information on Wisconsin hospitals, a Qualtrics electronic survey was designed with 4 distinct inpatient pediatric categories of newborn, NICU, general peds, and PICU, with the specifics of the survey questions as shown. The surveys were collected over the past 2 months via email and phone interview. We had 94% of all Wisconsin hospitals respond and 97% of the critical access hospitals who responded. Surveys were filled out by multiple types of healthcare staff, including chief nursing officers, nurse managers, directors, physicians, and more. The map below shows the hospitals who responded in green and those who are yet to respond in red. Underlaid that is the rural urban commuting area codes, which show a scale from most urban as dark purple and to most rural as white. For those non-respondent hospitals, data from DHS and WHA Information Center was used to supplement and make more complete maps. We also used critical access designation to define a hospital as serving a majority rural population. Our maps and figures were created using descriptive statistics with R and RUCA codes. So let's delve into our first set of results from our study, starting with inpatient newborn care. In the top figure labeled A is a map of inpatient newborn care across Wisconsin. If you look at the bottom table, 87 hospitals provide inpatient newborn care, and 32% of which are critical access hospitals. Back to the top figure, critical access hospital designation can be seen here in the dark green square, with all other hospitals in the light green circles. As can be seen, inpatient newborn care is pretty widespread throughout the state, with some gaps in the northern portion, which makes sense as these are the most rural areas of Wisconsin. Next, we move on to inpatient pediatrics throughout Wisconsin, generally admitting patients from the age of 0 to 17. Referencing the table below, 56 hospitals admit pediatric patients, with the average number of beds being 8, and the highest 250. 38% of these hospitals are critical access hospitals with an average number of 10 beds. Of note, 46% of these hospitals did not have a designated pediatric unit. Rather, many of the hospitals across the state would admit their pediatric patients to the general medical floor. In the figure above, labeled B, we have our map of inpatient pediatrics across the state, which is pretty similar to the inpatient newborn map, as it is pretty widespread throughout the state, with some minor gaps in certain pockets of Wisconsin. Moving on to neonatal intensive care unit in Wisconsin, there were a total number of 41 hospitals that had designated NICUs of levels 1 through 4. 3 of those were critical access hospitals, and notably they were all level 1, which is the lowest level of care regarding NICUs. The average number of beds are also shown, with an increase in number of beds with the increased level of care. In the figure above labeled C, we have a map which shows the clusters of NICUs in certain areas, and note that all 3 of the critical access hospitals that are NICUs are all on the northwest side of the state. Lastly, we have the pediatric intensive care units throughout Wisconsin, of which there are 5. 3 of the 5 are designated children's centers, none of which are designated critical access hospitals. The figure above labeled D shows where they are dispersed throughout Wisconsin. This figure however, helps us bring all of this information together. It shows us in detail which counties do not have any of these 4 services as indicated by white. Notably, there are 23 counties in Wisconsin that had no type of pediatric services available, most of which had higher densities of rural populations. There were only 5 counties that had all 4 pediatric services available. The rest of the counties are color-coded by hospitals in that county, which have this certain category. Now, let's switch to our other half of the project related to inpatient pediatric clinician workforce. Starting with inpatient newborn again, with specialty type on the left and number of hospitals who employ these specialties on the bottom, you can see in lighter green the number of hospitals for each physician category, with the number of those hospitals designated as critical access overlaid on top of it. For inpatient newborn care, pediatricians and family physicians rank the highest. However, family physicians are utilized at a greater extent in rural areas versus pediatricians or other specialties. Just to point out, there were also hospitals that used tele-neonatologists, nurse practitioners, and nurse midwives. For inpatient pediatrics, the physician workforce at all Wisconsin hospitals is majority pediatricians and family physicians once again. However, we are seeing the same trend as in inpatient newborn care, that family physicians are staffed at a greater extent than any other specialty in critical access hospitals. Of note, there are also some other specialties being utilized for inpatient pediatrics, which include pediatric hospitalists, general hospitalists, and telemedicine pediatricians. For NICUs in Wisconsin, most of them utilize neonatologists with or without neonatal nurse practitioners. In the 3 critical access hospitals in Wisconsin that have NICUs, they use telemedicine neonatologists and family physicians or pediatricians. Lastly, in PICUs, all 5 hospitals are staffed by pediatric intensivists, and 1 hospital noted they staff pediatric acute care nurse practitioners as well. This last section of this presentation is more about the qualitative side of the research and the conclusion. So this other qualitative data that we gathered from hospitals was regarding changes in goals of Wisconsin hospitals. There were many hospitals that had closed their services for inpatient pediatrics, with only a few expanding. Some hospitals noted staffing shortages or insufficient pediatric care experience was limiting their ability to continue to provide care. The COVID pandemic affected many of the hospitals as well. Advanced practice providers are being added to hospital programs, and many hospitals are looking to add telemedicine services as well. In conclusion, Wisconsin critical access hospitals continue to provide inpatient pediatric services despite workforce disparities and shortages in rural areas. Family physicians and pediatricians provide care in most critical access hospitals. Therefore, Wisconsin residency programs should consider continuing inpatient pediatric training. Some limitations of our study is that there was no quantifiable data collected on hospital capabilities for admitting inpatient pediatrics, nor were the proportions of staff, such as family physician or pediatrician, to see exact numbers at each hospital, all of which would be great for future studies to address specific gaps in accessibility and the physician workforce. I appreciate all of you listening in on this presentation today. I would like to thank all of those who supported me in this project as listed in my acknowledgements. If you have any comments or questions, please reach out to me as listed in my contact information on the STFM website or in the description below. Thank you.